Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a dear friend, Pete Hill. Pete is the host and founder of The D Word, featured on UK Health Radio. Welcome, Pete. How are you today?
I'm good, Lance. Thank you so much for asking me.
My pleasure. My pleasure. So, Pete, let's start off with a little bit background. What got you so passionately involved in dementia and ultimately starting the D Word?
Well, it's a bit of a long story, Lance, because it goes back to the early 1980s. In the early 1980s, I volunteered on our hospital radio station. I don't know whether you had them there in the States, but here in the UK, most major hospitals at the time had their own internal radio service. And so I volunteered. Mainly, I've got to be honest, because I wanted to be a DJ at the time. And during that time, it was a large psychiatric hospital in the north of London. And I was taken into a ward very early when I'd volunteered. And in that ward were a bunch of people who were, to me, looked very old. They were probably 60, 70, 80 at the time. And they were just sitting kind of motionless around a TV. And in the corner, there was someone who was probably about 20 years younger. I asked a nurse, and I said, what's going on here? And the nurse said to me, well, these people are all geriatrics. And being a teenager, I thought, okay. And I wondered, what's the lady over there who looks so much younger? Well, I spent 18 years as a volunteer at the hospital, and I learned that the lady sitting over in the corner was actually Catherine, who used to phone me up and request records on my radio show, and she had young onset dementia, and everybody else in the ward had dementia. So that kind of sparked an interest, but like everybody else, I went off, I got married, had a daughter, and things kind of came back together again in 2016, when after a career in public health, I got a job with the Alzheimer's Society here in the UK. I was managing 6 activity groups weekly for people living with dementia in the community. And it kind of came full circle. I thought, well, this was when I started in the 1980s. And suddenly in 2016, I'm back working with people living with dementia.
What has the reaction been to the D Word?
Oh, unbelievable. I think it's the only word I can use. I started the D Word really just to get people talking. It can be a dark subject, a subject people don't want to talk about. But I always remember that, remember my grandma sitting in a pub here in England with her friends, and they're all discussing their ailments. They got to that kind of age, but nobody would talk about the D Word. No, we don't talk about dementia. So I started the D Word just to get people talking. To be totally frank with you, I think most of my audience know this. I thought it would probably last about 3 months in June 2019. We're fast approaching our 200th show. And we have spoken to people like yourself, we've spoken to people all over the world.
Right.
And the reaction has just been, I'd say, unbelievable.
That's wonderful. Well, I know, I like the title of the show because I think it has a lot of, connotations and meanings. But to me, and you've probably heard this too, Pete, where, now in the 80s, maybe the 90s, maybe even early 2000s, doctors were afraid to say the C word, and even being around older family members and, people who are, more elderly in my life, they'll still refer to cancer as the C word. She's got the C word, or, but now I'm hearing more and more healthcare professionals refer to dementia as the D word. You know, and I think and I'll get your opinion on this in a minute, but for me, it's because and we still have a long ways to go, granted, but we've made such strides from where we were 20, 30, even maybe 10 years ago in cancer research and cancer treatments and even detections, that now it's not as scary. I mean, it's still horrifying, it's still terrifying, but it's not as scary as it was maybe 20, 30 years ago, where it would just be referred to as the C word. But now they're saying, they got the D word. And that's because, we have such a long ways to go with research and treatments and even testing for dementia that it's kind of substituted. Our D word is what the C word was, back then. Is that kind of the same premise that you chose that name for, or?
Yeah, absolutely spot on, because it has those connotations. I think with cancer all those years ago, it was concerning. It was a lack of knowledge, and also in terms of medical profession, they were really trying to catch up. Whereas I've had personal experience; they have caught up now, and it is far less scary than it was. But in terms of dementia, still, it's really simple terms. I mean, by friends, family, people I meet, question I get asked: what's the difference between dementia and Alzheimer's? And that registers to me that we've still got a long way to go in terms of education and stigma. And it's tough. I tell you, when I first started running activity groups here, I'd probably been employed about 2 weeks, and I'm standing outside a big church hall thinking, I've got to go in there and speak to 18 people living with dementia. And I thought, I don't know how I'm going to do this.
Yeah.
I've done public speaking, I've been on the radio. I'm thinking, hey, hold on, I'm a bit scared here. And then suddenly it dawned on me, why don't I just go in there and speak to 18 people?
Right.
So I went in there and spoke to 18 people. We like to laugh, we like to joke, we like music, we like sport. And we got on absolutely superbly. And I think we need to bring that across to people, that, and that's why I called it a D word. The other reason was, when people came to our groups, they usually came with a loved one or a carer. And I used to say to loved one or a carer, I said, the one word we don't mention when we go in the hall there. And they used to say, what's that? And I used to say, the D word, dementia.
Okay.
What is the point of me saying that is Dennis with dementia, or that is Iris with dementia? It's Dennis and Iris. And I guess that's probably, where the whole title was born.
Really interesting. When you look back at first starting the show, and I know you said you thought maybe it would just last 3 months or so, what's been the one biggest takeaway for you, Pete Hill, from starting this show almost 4 years ago now?
Meeting such amazing, dedicated people who are doing such good work. And it still seems to me that a lot of people don't know about it. Whenever I speak to someone, I'm always wanting to shout from the rooftops, hey, come and look at these people, let's see what they're doing. Because I talk to a lot of small charities. A lot of small charities don't have PR people to shout about things and tell the world what they're doing. And the thing I've taken away is I had no idea all this stuff was going on. Before I started the D word, I've gone all the way from people that take a horse box full of horses round, letting people who were living with dementia, like horse riding, get back involved with the horses. I've had a dementia-friendly barber. I've had all sorts of amazing people doing kind of wonderful things that I had no idea that they were out there.
What's the one biggest surprising thing you've learned about dementia since doing the D word?
I think probably for me, going back to my experience of the 1980s, that these are people. Let's take the D out of it, because everyone is different. Everybody is affected differently. We're all different, and we just treat people like people. And I think it's helped me as well in my own life to the way I look at things, and thinking, this can happen to anybody. I had personal experience, sadly, with my mother-in-law, but she didn't cease becoming my mother-in-law. And, she had dementia. She was Gwenda. And that was that. And I think that's probably the thing that, I've learned over 4 years now of the D word.
Wonderful. Now, you mentioned earlier that you had went and volunteered, or you were working with the Alzheimer's Society there in the UK. How long were you with them?
I worked for 2 years. I had two 1-year contracts. I started on a 1-year contract. It was then extended for a further year. So, so I spent 2 years, 6 groups a week. My maths isn't good, so I won't work out how many, but quite a few.
Sure, sure. What was the reason for leaving, or are you still with them, or?
No, I left. Again, sadly, as in US, as in here, financial issues come into play. I was employed by them. There was a lot of talk that groups actually were not going to exist anymore. They were going to be transferred to other companies, charities. And also, to be honest with you, I kind of felt I'd gone as far as I could in that format. And I wanted to do something else. I wanted to be involved with dementia. And it might kind of sound strange, but at the time I didn't know what. I thought I can do something else here. And so when the 3rd year's contract got proposed, I said, well, no thanks. I'm going to go away and do something else.
Okay. Now, when you look back on have you recorded your 200th episode yet?
Not yet.
Are you able to share who the guest is going to be? Do you have a special guest for the 200th episode?
Yeah, I can share it. It's someone you know very well. It's Laurie LeBay who's going to be my guest.
Wonderful. I can't think of a better guest to celebrate 200 episodes. Laurie is just a wonderful friend. And as you know, her and I do our show once a month together, Conscious Caregiving with L&L, and just a remarkable lady. And, I look at Laurie as really one of the founding pioneers of the whole, I don't want to diminish it, but I call it like influencer, difference maker, online presence, if you will, for the whole dementia movement. I mean, she's been doing this, I believe, since the late 1980s, I believe, maybe early 90s. There's a few of them out there that I just really, really admire. And there's a lot of people I admire and respect, but when you look at the ones that came before you, it's kind of cliche, Pete, but I say they made it easier for the rest of us. They kind of set the path, they laid the map out, and you just follow in their footsteps. And, I told somebody recently, I said, none of us, not just we being All Home Care Matters, but we as a collective, none of us should try to outshine another person or think better of ourselves than another person, because at the end of the day, we're standing on everybody else's shoulders who came before us. We wouldn't have this platform. People wouldn't be following it. And, Laurie is one of those people that I just hold in the highest esteem. So that I'll be looking forward to that. So let's talk a little bit about the stigma. So when you started the show back in 2019, have you seen the stigma shift at all? And if so, do you think it's shifted enough, or where do you see the stigma still associated with the D word?
I think it has shifted. I think it has got better. But I still think there is a long way to go. I think a lot of it is, as I was kind of saying earlier, a lack of understanding. And whenever we don't understand something, a kind of natural human reaction is to be slightly frightened and slightly standoffish. And that's that's a natural reaction to people. I gauge it that things are getting better in certain areas, but when I gauge my own family and my friends, they know what I do, but I still don't think they fully understand in terms of the whole dementia link. And I've learned so much from my friends who are living with dementia. And I try and impress on people that, you can still learn. And it really is a case of tell me what I can do. Don't keep concentrating on what I can't do. And I think the stigma still stays with that. I think a lot of the approach is, well, you now have dementia, so you won't be able to do this, and this, instead of you can do all of that. And I think that's something we really do need to work on. Here, post-diagnostic support in the UK is what I call a patchwork quilt. Depends where you live. Some is absolutely excellent. My only experience was to be given 2 sheets of A4 with a diagnosis. Thank you, away you go. And then 1 meeting with a mental health nurse, and I'll quote them directly. They turned around to me and said, "You used to work for the Alzheimer's Society. You probably know more about this than I do."
Yeah.
And that was it. So those, that's still stigma for me, just
Absolutely.
a complete lack of understanding in what people need.
And let me ask you, Pete, why? Because very similar here in the United States, and I think no matter where you're living at in the world, I think that's what unites all of us. Why do you think that still exists here in the year 2023?
It's a very good question, Lance. Very good question. I think it's, one, the lack of understanding. 2, we were talking about, the fact we're now the D word instead of the C word. When I talk to dementia researchers, they say, well, yes, that's true, but we wish we had the amount of money that was pumped into cancer 30 years ago, and we certainly would be a long way forward. So I think there's very much a financial aspect to it. And I think there are loads and loads of small organisations that are doing a great job, don't get me wrong, but I do worry that sometimes they tread on each other because they don't know the other one exists. And in terms of, we don't have anymore. We had it proposed in 2012 as a UK dementia strategy, never existed, and we don't have an overarching strategy in this country that all the healthcare professionals or the social professionals can plug into. So they're all away doing their own thing. Some of them are doing great stuff, but they're not joining it all together.
Yeah. And I think you kind of touched on something, and I don't know this to be a fact, but I've heard other people that I admire and respect their opinions and insights, and I tend to agree with this to a degree. You mentioned how there's all these smaller organizations all trying to do their part, and they don't seem like they know each other exist. It almost seems like they're trying to stay in their own silo, their own box, and they're not trying to learn that the others exist because they're just solely focused on their mission or their organization. But at the end of the day, all of the organizations, they're all working towards the same goal. So you'd think they'd be stronger together than divided.
Yeah, I absolutely agree. I mean, I had experience of this. I'm not going to name the organisations concerned, but well, you know what one of them is because I used to work for them. And there's another major charity in the UK here, which basically the two wouldn't talk to. They were doing the same thing. They were competing for the same amount of money.
Right.
And it just didn't make sense to me. And I think because, it'd be interesting, because here in the UK, okay, we're a small country, but we still manage to regionalise everything. We still manage to have small charities in Essex, Hertfordshire, Cambridgeshire, within the space of relatively a few miles. We don't have anything like, the size of your country there in the US, but we still manage to localise everything. And as you said, people are then going for their own local audience, trying to do their own local thing. Whereas next door, they might be doing something completely different. And it takes something to grab the two and bring them together and say, well, look, if you work together, surely you'd make a better job of this.
Right. When I kind of look at it, all these different podcasts, right? You have the D word. We have All Home Care Matters. We're not competing against each other. We're working together, and I think it's just for the betterment of everybody everywhere, which, hopefully we'll see that trend kind of change at some point where everybody just stands together for the common good worldwide, not just in the UK, not just in Australia or the United States or Canada, but we all are working together for that one common goal of finding a cure. But I think even while they're trying to find a cure, they need to work on raising awareness. And because I want to go back to something you were talking about, our company, not All Home Care Matters, but the company I work for, we do dementia educational talks all over the state we're in here in Michigan. And these are the most well-attended, energized, and interested people attending these events. I mean, we could get 100 to up to one event we did, Pete, in a church. The fire marshal made us move it out of this banquet room because there were so many people. We had to go into the church sanctuary because it was a lot bigger because of the amount of people that were there, because they're just trying to find something out about dementia. They, the one common thing, there's actually two that we talk about all the time, and that's when you've seen a person diagnosed with dementia, you've only seen that one person because, as you know, it can affect everybody entirely different. So there's not a one size fits all. The one commonality is they both have a diagnosis of dementia, but you might stop eating or talking, or you might start wandering. This person might become full of energy and, just eat everything because they don't remember they already ate. They're there to get information, not only for their loved ones, but for them as the caregivers or the carers, to help them better take care of that loved one. Because when they went to that doctor's office, like you did with that health nurse, all they got from them was a diagnosis and a piece of paper. That was it. And that's where I think we need to start. I think it needs to start in the medical schools and in these family doctors' offices, and educating them to how to prepare and support these families. Their loved one's going to be cared for one way or the other, somehow, some way, whether it's in a facility or at home. They're going to be watched and they're going to be cared for. But what about these caregivers and carers who are there day in and day out, trying to help that loved one? How do I get my dad a bath when now he's afraid of the tub in the shower, or, just afraid of water in general, or, he's staying up from 7 p.m. until 4 a.m. because he's not tired, but he'll sleep all day. I need to sleep, or I may need to work. There's all these things that I think we could start with that are a lot easier to start with. Ultimately, the goal is a cure and preventing it from, happening. But in the meantime, we need to support all these carers and caregivers who are there on the front lines, taking care of these loved ones, because they're the ones having to endure it.
Yeah, I sometimes look at some of those headlines, possible cure for Alzheimer's or whatever, and part of me thinks, hey, great, we're getting closer to where we want to be.
Yeah.
But part of me also thinks, well, wait a minute, that's suddenly taking the spotlight, if you like, off the dementia carers and the people we've got to care for now. Because certain people will be thinking, well, there's a cure coming up, so I don't really have to worry so much. Right. So it's a kind of double-edged sword, that, and I absolutely, echo what you've said, because it is such a terrible, difficult thing to be a dementia carer, and I certainly echo the fact that it's not one size fits all. I have a lovely lady called Angela who does all my admin and various, everything else for me, looks after me, basically. And she was a dementia carer for her husband, David, who sadly passed away a few years ago. And she knows 100% what it's like, and the lack of support that there was there at the time. And it does amaze me, because here there are certain financial aspects as well, in the fact that if you suffer from certain diseases, then you're looked after by the NHS. If you're living with dementia, then suddenly it seems to be something completely different for some strange reason. And it's not pulled into, and this is one of my things, but I spent, the majority of my career in public health, I didn't hear anybody mention the D word. And I'm now thinking, well, that was the biggest public health issue we faced, so why are you not talking about it? And it still seems to be over left field in a bubble somewhere, where diabetes, heart disease, cancer, etc., is all in the mainstream. And I really, don't know why that is. And I think the longer it stays like that, it almost seems that when someone goes into a doctor's surgery, if they have one of these, if I can call them, is facile phrase, but I can't think of anything else, these mainstream diseases, they go down one road. Right. If they have dementia, the doctor literally sits there and thinks, where am I going to go now? And that was my experience. People that I've spoken to, not just me, a lot of people have had that experience. And And with dementia needs grabbing and simple things. When I put something out on LinkedIn, I'm still a part of a LinkedIn group called Public Health Professionals. So every time I put something on LinkedIn, I think, well, hey, I'm going to copy this to Public Health Professionals. I'm probably the only person in the Public Health Professionals group who's talking about dementia. But I'm thinking at least that, I might get a message across. Someone might suddenly think, why are we not talking about this along with everything else?
Right. No, I agree with you. And I want to kind of piggyback off that, Pete, because, here in the United States, we have Medicare and we have Medicaid, two different things. Medicare is ran by our federal government. Medicaid is determined and ran by each of the individual 50 states. I was talking to, and I don't know if you've interviewed him. If not, I highly recommend you reaching out. His name is Dr. Jason Karlowish. Are you familiar?
No.
He's a preeminent specialist in dementia and cognitive issues. He's the head of the UPenn Memory Center at UPenn Health System, a premier health system in probably the world. And he wrote the book, The Problem of Alzheimer's. Tremendous book. I highly recommend you read it. And when I was interviewing him and going through the book, one of my questions to him was, because he's a medical doctor, very, very established, why is it that these families go to these hospitals, go to their doctors, and they get a diagnosis, and that's all pretty much what they get? There is no real resources. I mean, there are, but nothing like you can get for these other, quote unquote, mainstream health issues. He says it goes back to medical education, to the beginning of time. Medical doctors, and you're probably familiar with this, they would see an elderly person. They're acting, quote unquote, and I don't like this phrase, but out of their mind. They're acting senile. So what they would do is they would diagnose them with senility. They're just senile. Nothing you can do for them. They're just old age. Let's put them in a home. And then with Medicare states that doctors are going to treat, or Medicare will provide services for healthcare issues, not for social care issues. Dementia fell under social care. So you got the medical establishment from the education where all these doctors are learning how to treat and care for patients and diagnose. Then you have, our federal, most people with dementia, early onset aside, most people are getting dementia after the age of 65. So they're going to be on Medicare. Medicare is not going to provide them with carers or caregivers in their home. That's what we do. That's why home care exists, not just for dementia, but for other, activities of daily living and whatnot. But the point is, this is ingrained, at least here in the States, in our healthcare education going back to the Stone Ages, where these patients, a doctor wants to treat you and cure you and diagnose you, right? That's their job. That's how they determine, quote unquote, their success versus failure. Well, you go into a doctor and you have dementia, they sort of can treat it, maybe. They're not going to cure it. They don't. So if they go down that road you're talking about with the mainstream health issues, what's going to happen? And I'm just paraphrasing, or maybe I'm making an assumption, but this is just from the outside, my opinion, they're going to look like they failed you because they couldn't treat you and they couldn't cure you. So now they haven't done, quote unquote, their job as a doctor. So I think they tend to try to, stave it off. And I don't want to go that way because I can't really help you, Pete. I can't give you a medication that you're going to feel better after a 7-10 day course of it. We can determine you have dementia, but really, right, the only true 100% fact way of determining a diagnosis is postmortem, when you do an autopsy on the brain to see the plaques and the tangles and things. So I think it's ingrained in that system going back before you and I were even here. And it's just kind of continued, and I think it's changing. I do think it's changing. We had Dr. James Vickers on, who's another wonderful man doing groundbreaking work. Are you familiar with him?
Yeah, heard the name. Yeah.
Well, he's the head of the Wicking Institute for Dementia Center, Research and Education. In Australia, they have bachelor degree programs now, and they have master's degrees programs specifically in dementia. I don't know of any other higher education, university, or college in the world that offers these programs, but he was also the head of their medical school. And so I had a chance to ask him, are we teaching doctors now in this year, 2023, the ins and outs of dementia, and it's not just the patient that's affected, but it's their mom, their wife, it's their son, their daughter, or their caregivers, so that they can better take care of that person in their home or wherever the support is needed at. And he's making some groundbreaking changes in medical education and through dementia education. But I think it all goes back to, like we originally started saying with Dr. Jason Karlowish, where Medicare and the government didn't want to view dementia back in the 60s as a health issue because it's still viewed as senility. They didn't want to train these doctors because, medical education has changed so much in the last, 50, 60, 70 years, whatever, where we don't want to waste our time and our gifts on somebody that we can't fix. We want to just, that's not something we can help. They have seen senility. Let's just put them in a home and we've done our job. That's what we can offer them. Well, now as we've evolved and we become more educated and we understand it better, I think the medical, community needs to kind of catch up. And I think they're trying to, but I think there's leaps and bounds, because when you have a nurse telling you, as far as I know, you're not a medical doctor, you're not a registered nurse, but you worked in public health, she's telling you that you probably will know more than she does. That's a problem, because the family shouldn't be the ones expected to figure it out on their own. And we come into contact with so many families where, they're coming to all these seminars and conferences that we run, and they're like, thank you, thank you, thank you, because we can't find this information anywhere. We can go on the internet, but that opens up a whole nother ball of wax. There's so many things on the internet that are just bad information. They're either going to scare you to death, or they're going to give you false hope, and it could potentially cost you a lot of money because you're going to try all of these, guaranteed results and cures that just don't exist.
Yeah, I think here that we have this disconnect still between health and
Right.
social care. Now we try and pull it together and we say health and social care, but generally people don't understand what that means.
Right.
And that's something that, I think worldwide, but as out of it, we need to work on, because I don't see why social care isn't part of health. Because if you've got adequate social care, then obviously it adds to the fact that you're going to be a healthy person. If you have inadequate social care, then it's kind of a detrimental effect on your health. And I think I agree with you. A lot of it is from a budgetary point of view. Here in the UK, we have this kind of disconnect between the NHS and what happened in 2013 was public health was given back to a local authority level to deal with public health. And then suddenly you had the NHS as a big national organisation, and we had a number of small county organisations that were looking after public health. And again, we had this disconnect between the two. We still have people, we have loads of arguments here in the UK, loads of headlines with what they call bed blocking. And bed blocking basically is people in the NHS who can't be discharged out because they don't have social care to look after them. So you can't take them out of hospital because you haven't got anywhere to put them, in really simple terms. And a large number of those people are living with dementia. And that is something that the NHS still hasn't really got its head around, because there's this disconnect between the medical model, as you say, doctor, I'm going to prescribe you something, I'm going to do a brilliant job, and I'm going to put you right, to social care. We've got to make sure you are living in the right environment to give you the best chance that you've got. And until we close that gap, we're still going to be in a problem. And in terms of, I saw my own mother-in-law. She had a fall. Unfortunately, she had a very mild fracture, but it was a fracture, a small fracture. She went into hospital. She was there for 2 weeks, I think, while it healed. And there's no doubt her cognitive ability declined in the 2 weeks that she was in the hospital. Because, while they were dealing with are you in any pain, have a pill, or we've got to make sure your leg's extended, put that in a plaster, or whatever they did, nobody looked at the fact she was living with dementia at the time. So that bit didn't get treated at all.
That's I think the same situation here. I mean, it just, one hand doesn't know what the left hand's doing, and the left hand and the right hand, it's like they won't shake hands because they're separate and they want to stay separate. And that's the part I just don't understand.
Yeah, absolutely agree. I mean, it just seems, you said earlier about, us people that do podcasts and out there. And I don't want to blow our own trumpet too much, but I think we are a really good model, because I've worked also semi-pro in the radio industry here, nothing to do with health or whatever. And it can be a really cutthroat place. The reason why I didn't want to move, I had offers to go professionally into the radio industry. And I thought, hey, no, I'm a guy with a mortgage and a family. I don't want to get involved in this. And when I started the D word, Laurie was the first person I came across, Laurie LeVay, Alzheimer Speaks. And I thought, hey, this is great. We should be doing this. Someone else should be doing this. Someone should be doing it in the UK. Turned out to be me. I then got to talk to loads of other people in the UK who said, oh, that's a good idea what you're doing. I think we'll do a podcast. And so I started helping them. I'm friends with them. And like you've said to me, if we have someone that's, hey, this person's really brilliant to talk to, then we email each other and say, hey, if you talk to whoever, and that's the way to go about things.
Right.
I've never had a bad word. I've never had an argument, a falling out or anything with anyone that does the same as I do, because we all want to work together to the common goal. We're only a microcosm, I know, but surely those people in authority could, just learn a little bit of a lesson from that,
right,
and start working together for a common goal.
Yes. Well, speaking of podcasts in the UK and social care, good friends of ours, they have the social care show over in the UK. Mark Tops and Adam Purnell. Are you familiar with them?
Yeah. Yep.
Yeah. I mean, they're really beating the drum on raising awareness to the importance of social care. And I think it's just brilliant the way they're going about it. They, after we had interviewed Adam and Mark, Adam actually was asked to give an address to the House of Lords, and we put that video in at the end of their interview with us. And I think it's just keep chipping away, and eventually it's going to crack. But what I want to ask you, Pete, because you've been in this field a very, very long time, back to your teen years. So that was about 10, 15 years ago or so. What do you see it's going to take for either the UK or the world, either one you want to go with, to really all get on the same page and really go at this?
I think it's going to take the realization that sadly there will be a very large number of people that will be affected by dementia, not only living with it, but also people that are taking care of family members and loved ones, organisations that have to take care of people in care facilities. And, someone somewhere is going to add all this up. Mm-hmm. The world, sadly, is ruled by finance. And it just needs someone to add all this up and say, whoa, wait a minute. If we approach this differently, then we can save you that amount of money. And we're talking billions here. That needs a wake-up call. Yeah. The problem we have in the UK, same as you in the States, okay, we have a 5-year government. So whatever gets put in, you're in real danger of in 4 or 5 years' time being removed by the next lot coming.
Right.
So we really want a message that nobody can ignore. It doesn't matter whether you're Tory, Labour, Liberal, Democrat, whatever you are, you just cannot ignore this. And we've seen it a little bit in what's happened with climate change over the past, even a couple of weeks, really, but a couple of months. Suddenly, I think everybody's woken up to the fact of, wait a minute, we can't ignore this. And, dementia needs that kind of magic bullet of, wait a minute, this has got to such an extent now that we can't ignore it. I think it's sad we have to get that far.
Right.
Because I think it'd be nice if someone had done some horizon scanning and thought, well, hey, we can do all this before we get to that stage. But sadly, I think it's when we get to that stage, as you say, keep chipping away, that's when the cracks might start appearing.
Yeah. And sadly, health should never be a political issue. It should be very bipartisan. And I know here in the States, our President Reagan, it came out, that the last, I don't know, I'm going to probably get this wrong, the last year or two, or maybe his second term, he was living with dementia, and it was kept very hush hush and private. But my hopes would have been, okay, if our president of the United States can have dementia, none of us are immune from getting it. In fact, there's a quote out there about dementia where it says, it doesn't matter what color you are, what sex you are, what religion you are, what country you're from. If the president of the United States can get dementia, so can you. And that should really raise alarm bells in everybody's head. Nobody's immune from it. There's no avoiding it. You can't be one thing or another and say, well, I won't get it now. But I'm just wondering, is it going to take somebody, again, like a President Reagan on an international scale to get it, where now the rest of that political body that is under that person, regardless of the country, says, okay, look, if they can get it, we need to do something, because there's millions of people living with this. And I believe there's a lot of people living with it, misdiagnosed, that don't even know they have it. And we need to do something about it. It's a global epidemic.
Yeah, absolutely. I mean, sadly here, I don't know whether that will actually resonate, because we had a prime minister back in the 70s, Harold Wilson, who actually gave up his premiership of the UK because he got diagnosed with Alzheimer's.
Okay. Is that when
I don't know whether that's widely known.
Okay.
But the time it was widely known is that Netflix put it in the Crown series that a lot of people here have watched, and actually came out loud and clear in the Crown. Harold Wilson had early onset, and he was not going to be Prime Minister anymore. So I don't know, how do people react to that? I take my hat off to people like Bruce Willis and his family, who come out and say, hey, this is the situation. I'm a big sports fan here in the UK, and nearly half of our World Cup winning soccer team from 1966 have either sadly passed away having lived with dementia, or are now living with dementia. And that, for me, for a sports fan, I think, what? Wait a minute. There's only 11 guys on the pitch here. Well, there's 5 people on the pitch out of 11. And you're thinking, hey, this is really a big thing. For me as a sports fan, it was a really big thing. I mean, the situation with sport, I mean, that's probably a conversation for another day. I read a book called League of Denial, which was all about the NFL and the way that they treated dementia, and that's an incredible eye-opener. But it takes an inquiring mind a little bit as well to look into these things,
right?
I think. And people have so many other things, and it's I don't know. I don't want to use the word competition, but it almost is. You're going to worry about climate change. You're going to worry about cost of living. You're going to worry about cancer. You're going to worry about getting dementia. And in some way, I think a lot of people just bury their heads in the sand and say, well, hey, I don't want to delve into all of that. And
it'll never happen. Yeah. And it'll never happen to me.
Yeah,
and,
exactly.
And that's kind of my personal thoughts is, until it directly affects somebody in a position of power, a decision maker, I just feel like, people just go about it like it's never going to happen to me. Why do I care? This doesn't matter to me, and that's the sad part about it, because I believe everybody will know somebody that has been diagnosed with dementia at some point in their lives. Talking about the prime minister, did Thatcher took over for him, correct?
No, Thatcher was later, but
later. Okay, but
she developed. She was living with dementia after she'd been put out of office in 1991, I think.
Okay.
Yeah.
I knew she was she was also, I believe, one that had been diagnosed with it. But it just goes to show you, though, nobody's immune from this terrible illness, and we just all, through the D Word, through All Home Care Matters, Lori LeBay, and all these other wonderful people, we need to keep just chipping away, and eventually, hopefully, it will crack. I want to get ready to wrap up here, Pete, and I do appreciate your time, and I'm a huge fan of the D Word, and you're just a remarkable man, and I'm glad to call you a friend. I want to just touch briefly, because when we introduced you, we talked about UK Health Radio. I want you to talk a little bit about UK Health Radio, because you guys have a great following there. You're doing great work. I encourage all of our viewers and listeners to go check it out. But share with our viewers and listeners what the UK Health Radio is and what it does.
Yeah, UK Health Radio was established just over a decade ago by an amazing man, Johan, who's the CEO. He established it after he was diagnosed with cancer. And at the time, he was diagnosed with terminal cancer and decided that he wanted to do something about it. He looked up a lot of information and he thankfully, managed to pull through. And when he pulled through, he said, well, I really want to do something with the rest of my life. I actually want to get health information out there to people. And the best way I know how to do it, he was actually a fashion photographer, was his job at the time. And he said, I'm going to start a radio station. So UK Health Radio was born. It covers every area of health. I don't think, I say every area of health. I didn't cover dementia till I arrived. So it's now got, I think, nearly everything covered. There's shows every week. There are podcasts. There's listen again and download, all the stuff that you can do with audio. There's stuff on YouTube. And it really is just about getting their health message about. So I've got to say, they've been great to me. I love working with them. They are so easy to work with. And also, you don't need pots of money or stuff like that. You need someone to say thank you every now and again. Right. And they're brilliant at doing that. And they've got an audience now worldwide of 1.3 million a month, which is pretty awe-inspiring and a bit frightening sometimes when you get behind a microphone and think, wait a minute. A lot of people out there listening, but it's a great organization and they're doing a terrific job.
Well, we're going to encourage everybody to follow the D Word, subscribe to the D Word, as well as go and follow, like, and subscribe to UK Health Radio. Anybody that's making a difference like you guys are, we want to support you however we're able to. I just want to end on two more questions for you, Pete, if you got a minute. What are two things you would want to improve on for people living with dementia, or want people to know about?
First one is better diagnosis and earlier diagnosis. Obviously, we had a lot of headlines and very positive headlines about new drugs that are coming on board. The only thing with those new drugs that are coming on board is they are effective, but in the early stages. So in order for them to be effective, we need to get diagnosis, and we need to get diagnosis a lot faster than it is. Again, as I say, here in the UK, it very much depends where you live. I've spoken to people in Kenya, was a good example. If you can't get to Nairobi, then you're not going to get diagnosed. It's quite as simple as that. You can have an 8-hour journey to try and get a diagnosis. We need to definitely make sure that everyone that requires it gets a timely diagnosis. And number two is, follows on from that, when people have that timely diagnosis, they're given post-diagnostic support, and they're not just told, go and look at this website, read this book. Because as you said, go and look at this website and can lead to Dr. Google and all kinds of places where you don't want to go. Right. And also reading this book is not really going to give you the experience of what's about to happen. So we need an effective, joined together post-diagnostic support system, grabbing together all these people that are doing all this great work and joining them into it.
Wonderful. If just want to follow up on that answer, If you were talking to somebody out at the, coffee house or at the library or at the grocery store, and they said, Pete, my mom was just diagnosed with dementia. What do you recommend I do? What would your answer be?
My answer would be to find what's available in the local area and start talking to people who are in a similar situation or who have been in a similar situation. There are, thankfully, lots of really good small groups where carers can get together, carers can share exactly what's happening to them, what's happened to them, give people advice, be a shoulder to cry on if necessary, be someone to celebrate with if necessary, and just get yourself involved in the community. When I was with the Alzheimer's Society, I sat outside the hall one day, and I'd probably been there about a month, and I had someone burst into tears on my shoulder and wanted my advice. I didn't know very much at the time, but I knew that I was a human, they were a human, and we just talked.
Yeah.
And I still know that person. And I probably saw her about 2-3 months ago. And she said to me, you know what, I still remember that conversation we had. And I said, well, that's great. I said, I'm sorry, I wasn't particularly objective. She said, you were great. It's just what I needed at the time. And that is, you just cannot underestimate good social contact. And that's one thing that you can't prescribe, can you? You can't give a pill for it.
Right.
And it's all out there. So please go and find it.
Wonderful. Great advice, Pete. And last question for you today. We're going to talk before this, but I want to know, if we talked again in 5 years, where's the D word at?
That's a really good question, Lance. Probably 400 episodes by then, but hopefully at the moment we're still doing what we do, because I enjoy it. It's great. I love it. It's the best job I've ever had. I talk to some absolutely amazing people. I make new friends like yourself every week across the world, and that is just wonderful for me. I learn a lot. I've learned a lot. And I hope that all the bar shows which are available to download. Somebody said to me the other week, and I didn't even thought of this, they said, that's quite a resource, all your shows, because it allows people to look at all these different things that are going on. And I thought, yeah, actually it is. It's a good resource. So, I hope we're still going. I hope that the message is getting across. At the moment, I mean, it's something we've got to manage. I think I've got 4 spare slots between now and the end of the year, because we've got so many people who want to talk to us, which is amazing. I think
our interview's coming up too, isn't it? Yeah.
You are definitely right on there. And, that's been amazing. So if we're still doing that in 5 years' time, then, I'm going to be a happy man.
Wonderful. Well, Pete Hill, founder and host of the D Word on UK Health Radio. Thank you so much, my friend.
Thank you, Lance. Thank you so much. And I really look forward to talking to you on the D Word.
Wonderful. You have a good day.
You too.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Pete Hill from the D Word. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.